Firnhaber, and I want to thank you for taking a half an hour out of your life to find out a little bit more about how our bodies work and how we can look at our bodies differently to get them better. So tonight's talk's on functional medicine. Before I get into the slides, I want to talk about a video I saw this weekend that was very, very interesting. It just came up on my feed. I wasn't even looking for it. And it was one physician that was interviewing another one. And the interviewing physician was a surgeon from Tennessee who wrote a book that's out right now that you can get called Lies My Doctor Told Me. Have you ever heard of that one?
I've heard of it, but I haven't read it.
I haven't read it either, okay? But he was interviewing another physician who's a full professor at USC Medical School. And he's coming out with a book in June. It's going to be released in June called Lies I Taught My Medical Students. So one was interviewing the other. Now the reason I bring this up is because the one that's coming out with the book Lies I Taught My Medical Students, he said a few years ago he had some health issues, so he goes to see his physician, and his physician diagnosed him with 4 different chronic diseases. And he said, here's the drugs you need to take. You're going to be on them for the rest of your life, and that's the end of that. So he goes, so this is a guy who's teaching in, your traditional medical schools, who goes, I don't want to do that. I don't want this. Mm-hmm. So he did some research, and he found out that his conditions were due to what he was eating and his lifestyle. So he completely changed what he was eating, changed his lifestyle, and I don't know how long it took, a year and a half, got rid of all 4 of the diseases that he had. And so now he's completely changed. He's moving much more in a functional medicine direction, as is the other physician who was interviewing him. And it was interesting because they were talking about just so many of the stupid things that are done in medicine that just hurt people that don't make any sense. So tonight, we're going to be talking about a new paradigm or a new model of healthcare called functional medicine, which is one of the things I do in my office. So now this is working in my office just fine. I don't know why it's not working now. Let's see. There we go. So if we look at current health statistics, and some of you may have seen this before, the U.S. spends more on healthcare than the next 10 highest countries combined. We have less than 5% of the world's population. We take 50% of the world's drugs and 80% of the world's painkillers. Now, do you think that we have more pain in this country than any other country? That's why we need 80% of the painkillers. According to the World Health Organization, the U.S. spends a higher proportion of its gross domestic product on health, but ranks 37th among 191 countries in effectiveness of healthcare systems. So you wonder what's wrong with this picture. The 3rd leading cause of death in the United States is the effects of properly prescribed pharmaceuticals and hospital errors. Okay. So our healthcare system does some things really well, and I will certainly acknowledge that. Trauma care, but even the world's leading medical journals have stated that we need a change. So this is out of the New England Journal of Medicine, September 6, 2012. So NJAM, New England Journal of Medicine, is one of the top 4 most prestigious medical journals in the world. Okay, does anybody know the other 3 by any chance?
British Medical Journal.
British Medical Journal, certainly one. How about the other ones? JMA, Journal of
Yeah.
American Medical Association. The other one would be Lancet. Okay, Lancet's also a British journal. Okay, so it says, now this is a quote right out of New England Journal of Medicine. Although the United States pays more for medical care than any other country, problems abound in our healthcare system. Unsustainable costs, poor outcomes, frequent medical errors, poor patient satisfaction, worsening health disparities all point to a need for transformative change. Unfortunately, many modifiable risk factors for chronic disease are not being addressed adequately. A prevention model focused on forestalling the development of disease before symptoms or life-threatening events occur is the best solution to the current crisis. Now, would you agree with that preventing disease is probably better than trying to treat it, letting yourself get it and then treating it? Now, what does the old saying go that my mother used to tell me growing up, an ounce of prevention is worth a pound of cure? Yeah, that's really true. So our current system does really well with trauma care. I mean, if you have a heart attack or a serious accident or you're shot or stabbed or whatever, the system works really well. But this system does not work well for things like fibromyalgia, diabetes, chronic fatigue, or arthritis. So we're going to look at another approach. So what is functional medicine? It's an approach focusing on identifying the causes of disease rather than using pharmaceuticals to treat symptoms. So we look to discover the origins of chronic disease so that meaningful treatment and prevention can be implemented. So we ask two basic questions. Is there something in the body that shouldn't be there? For example, parasites. Okay? Does somebody have parasites? You think parasites might cause a problem?
Yeah.
Yeah, okay. By the way, where do we get parasites from?
Go to Russia.
I would say Africa more than Russia. Yeah, where do we get them from?
I'd say from food that's not cooked.
You can.
Contaminated.
Yeah.
Yeah, it used to be with pork, you had to
Yeah, you can
cook
get
it really well or you get the parasite.
Yeah, you could do that.
Trichonoma.
You can get them from your pets. You think
That's
some of your
right.
pets might have parasites?
Yeah.
Sure. You can get them from
Yeah.
pets.
Yeah.
Okay, so you can get them from drinking water, going overseas and getting sick. Come back with parasites that never quite get better, never quite get killed. Hidden bacterial or fungal infections, toxic chemicals, heavy metal toxicity, toxic fatty acid. Anybody ever give me an example of a toxic fatty acid?
French fries.
They're cooked in it. Yeah.
Okay.
Yeah. French fries are pretty toxic. Okay.
Vegetable oil.
Crisco,
Yeah.
Crisco's a toxic
Ooh,
fatty
yeah,
acid.
yeah.
All your vegetable oils on the store shelves are all toxic fatty acids. In fact, both of these physicians that were going back and forth were talking about avoiding toxic seed oils like safflower oil, peanut oil, things like that. Structural imbalances. What profession treats that? Oh, most of you are my patients, chiropractic dentists. I thought that would be a no-brainer.
Yeah.
Okay. Medication side effects. Anybody ever hear of that?
Yeah.
There's plenty of that going around. Food intolerances such as gluten, dairy, and soy. Toxic emotions such as anger, greed, resentment, or unforgiveness. Or is the body lacking something that it needs? Okay, so trace minerals, specific vitamins, enzymes, probiotics, exercise, diversity of gut flora, positive relationships. These are all things that could be an issue. What would be an example of somebody who has a trace mineral deficiency? Anybody know? Anybody think of anything? Got a trace, yes.
Iodine?
Okay, iodine, yeah. So maybe
Thyroid.
you have a thyroid issue. We don't have much iodine in the middle of the country here. We don't get a lot of it.
Zinc.
Zinc. Okay, what would be an example of a zinc deficiency, somebody with a zinc deficiency?
I'd say vegetarian.
Okay, well, what would be,
Could be, 'cause
what
they
what
don't
would
eat
be
protein.
an example of somebody with a zinc deficiency? What might happen? How about they get sick a lot? Zinc's really important
Yeah.
for your immune system. Okay, so they get sick all the time. That could be other things too. How about this one? Somebody gets muscle cramps a lot, especially at night. That'd be a classic what deficiency?
Magnesium.
No.
Magnesium.
Magnesium.
Magnesium?
I drink
Deficiency.
calcium, I drink milk, and I get rid of them right away.
Okay,
That's
well,
why I say it. Yeah.
okay, that's
It
okay.
works for me.
Yeah, good. So, you ever see anybody with exercise deficiencies?
Yeah.
Quite a few
All
of
of
them
us.
out there, yeah.
All of us, yeah.
That's a really important, man. That's a really important thing to do, okay? So, are the health issues we face in our civilization mere pharmaceutical deficiencies? For example, 1 in every 10 people in America takes some sort of antidepressant or some sort of psychotropic drug. So do they have Prozac deficiencies or Wellbutrin deficiencies or Zoloft deficiencies? No, they don't, okay? They don't have it, okay? How would a functional medicine practitioner evaluate something like chronic depression? So, we gotta ask, what could be causing the brain to malfunction? Okay, could it be trapped emotions? Like, you have some sort of trauma that you never get healed from. That could be an issue. Food intolerances or gut flora imbalances. Why would that affect the brain? Anybody? Some of you who've been to my talks before should know that one, but how about the gut-brain connection with the vagus nerve, okay?
Yeah, Vegas, yeah.
So what happens in the gut, we know can affect the brain. And we know that gluten intolerances and wheat intolerances can actually cause inflammation of the brain. And we know, and we can measure that.
Question. Does PTSD come under trapped emotions?
Yeah, PTSD definitely under that.
PTSD,
Definitely, yeah. So lack of sleep, poor heart function, fatty acid imbalance. Why would fatty acid imbalance affect brain function? Anybody?
Well,
You've been to my talks, you
the
should
brain
know that
is-
one.
The brain is what, 60% fat?
Good job. Yeah, that's right. Your brain's mainly fat.
Yeah.
Brain basically is a big glob of fat.
Yeah.
That's what it is.
That's what we
Okay.
think with,
It's a
yeah.
big glob of fat. So if they're all kind of fat in your brain, it ain't gonna work right. Okay.
Yeah.
So anybody know what the best fat for your brain is? Anybody?
Eggs?
Eggs are really good. Really good. Yeah, they contain choline and lots of other things. Eggs are really good for the brain.
I'd say avocados.
Avocados are good. Omega-3 fatty acids, that's the really good brain fat, okay? Not the only one, but it's one of the
That's
best
one you
ones.
can use, yeah.
And elevated blood sugar can cause issues with brain function. Okay, so one of the most common drugs prescribed are statin drugs to lower cholesterol. So about 30 million Americans take them, but the problem is they create a lot of side effects, including brain dysfunction, okay? And they prevent the biosynthesis of really important compounds like vitamin D, CoQ10, and all of our sex hormones. So typical side effects of statin drugs are muscle joint pain, memory loss, energy loss, loss of sex drive, low testosterone, diabetes, and it actually increased the overall death rate. That's what the research shows, okay? So, for example, most conventional doctors would normally prescribe pharmaceuticals like Prilosec, Prevacid, or Acifex to treat acid reflux or heartburn. Anybody ever seen this happen before? People? Doctors prescribe Prilosec.
Yeah.
Happens all the time, yeah.
Yeah.
So what I would do as a functional medicine practitioner is I would really try and look at causes of what might be going on. So you could have low stomach acid, low enzymes, chronic food intolerances like, gluten, dairy, soy. Those are really typical ones. Peanut allergy, peanuts, another one that a lot of people are really intolerant to peanuts. Leaky gut, which I see a lot, could be an H. pylori infection, gallbladder dysfunction, hiatal hernia, or just too much soda pop, okay? Yeah, which is one of the worst things you can put into your body is soda pop, okay? What would be another really, really bad thing to eat and put into your body? Can you think of something else?
Smoking, I don't know.
Smoking, yeah, that's real. That's not good.
Alcohol?
Alcohol, yeah. How about donuts?
Yeah.
Dunkin' Donuts, yeah.
Darn it, yeah.
Yeah, they taste good, but
What
they're,
about ice cream?
yeah, ice cream is another one. Highly processed foods, yeah, highly processed.
Yeah.
Okay, so if you look at disease, these named diseases like diabetes, cancer, arthritis, fibromyalgia, autoimmune disease, obesity, these are things that we put names on. But what are the underlying causes of those things? Hormonal imbalance, inflammation, toxicity, structural imbalances, immune issues, digestive issues, mitochondrial dysfunction. What do the mitochondria do in our body? What do the mitochondria do? Does anybody know?
They're the powerhouse to our cells.
Yeah, good job. They create energy, okay? So if the mitochondria are poisoned, okay, due to toxicity,
It's not good.
yeah, you're not going to be able to create energy. So toxic chemical exposure, toxic emotions. So where do we get toxic chemical exposure in our culture?
Agent Orange? No, kidding.
Well, if you're in Vietnam, you got it.
No
If
doubt.
you're Vietnam in the 60s and 70s, you
Yeah.
got that.
I'd say from plastic.
Yeah, plastics, right. Now, a couple of months ago,
Everything comes in plastic.
about 6-7 weeks ago, I did a 10 Minutes of Truth, and I talked about, your average plastic bottle of water may contain 100,000 tiny, tiny particles of plastic that gets into your cells and screws up your metabolism. And it's hard to get rid of that. But I do not recommend getting bottled water and drinking it. I do not recommend that.
Okay.
Research shows that there's plasticizers in there, and it really can mess up your metabolism. So let's talk about this real famous guy by the name of William Osler. He started Johns Hopkins Medical School, and he's the one who started the residency program. And he said this: the good physician treats the disease, the great physician treats the patient who has a disease. It's more important to know what sort of patient has a disease than what sort of disease has the patient. I think that's pretty darn good. Yeah, that's really important, because as much as I believe in lab work, an individual is more than just a lab test, okay? The object is not just to get the numbers down. The object is to help the patient function better. I've seen that happen before, where people come in and they say, well, my numbers are down, but I feel terrible. Well, that's not necessarily the object all the time. Here's another thing he said. He said, if you listen carefully to the patient, it will tell you the diagnosis. So this encapsulates the importance placed on taking a very thorough case history. So how does a functional medicine practitioner find the underlying cause or causes of illness? Case history, really important. You can't do it in 5 or 10 minutes. You can't do a good case history in that amount of time. A solid physical examination. This is one I do, looking for dysfunctional organs that can be treated in the office. And then specific laboratory tests targeting the systems or biochemical functions in the body. Really, really important. And sometimes we're looking at these are not just your standard blood tests. We're looking at things like, leaky gut. We're looking at toxic chemical testing. We're looking at food intolerance testing. Those things can be really important. So I'm going to talk about 3 case studies that I've had in the office. This is a 40-year-old female that came to see me. She had daily stomach pain, which is getting more frequent, alternating constipation, diarrhea, stomach pain so bad it caused her to lay in bed most of the day, in fact, many days, and past gallbladder removal, which can cause a lot of problems. Your gallbladder is actually a fairly important organ for a lot of reasons. And she had anxiety and depression. She was on Prilosec for 10 years. So what I found when I did the exam on her, she had a hiatal hernia, ileocecal valve dysfunction, this is the valve between your large and small intestine, low stomach acid production, low pancreatic enzyme production. Now I can find all 4 of those in my office without doing any lab work, just doing an exam on the patient. So what I did is I fixed her hiatal hernia. I gave her bile salts to make up for the fact that she didn't have a gallbladder, which is really, really important. Gave her stomach acid supplement and bitter herbs to stimulate digestion. So the results, the stomach pain is much better. She still has occasional mild pain, more energy, better focus, no longer needing bed rest because of the stomach pain, and her bowel movements are much, much better. There's another one, 71-year-old female that came to see me. She had chronic fatigue, fibromyalgia, anxiety, depression, suicidal thoughts, poor digestion, constipation. I mean, if you're really constipated, that'll make anybody depressed, really.
Yeah.
Poor memory. And so my findings, she had multiple food intolerances, low B vitamins, especially inositol, poor conversion of thyroid hormone T4 to T3, which is really important for running your metabolism. She had fatty acid imbalances, very, very high arachidonic to EPA ratio, which means that she was inflamed. She had a lot of inflammation. Low vitamin K, and she had vitamin D deficiency. So here's her past history of illness and medication. She had failed lower back surgery, bipolar, thyroid cancer, appendix out, multiple auto accidents, and abusive family relationships. You think that this could cause some problems in somebody's life?
A lot.
Yeah. And here's what she was on as far as pharmaceuticals. So what I did is I corrected her nutritional deficiencies. She stopped eating the food she was intolerant to. I gave her Brazil nuts to increase her selenium, which helped increase the conversion of T4 to T3. Gave her low force chiropractic care, which is what I do in my office. And so it took about 3 to 4 weeks, but the suicidal thoughts got better. Depression improved significantly. Back pain improved, and she was able to decrease her medications. She couldn't get off all of them, but she could at least decrease them. And here's the last one I want to talk about. And I could talk about more. I've had lots of patients. But this is a 13-year-old female who contracted mono 12 months before she came to see me. And then she got the flu after that. And here's what she developed these symptoms, and she had to drop out of the second semester of 7th grade. Daily migraine headaches, persistent vomiting, chronic fatigue, daily moderate abdominal pain. That's a 7th grader. I mean, 7th graders shouldn't have that. My findings were autonomic nervous system imbalance, specific food intolerances, and adrenal fatigue. Okay, now, this is a patient that I didn't do any lab testing on. I did everything in office. No blood work, nothing. Okay, So, and part of the reason was her mother was going through a really bad divorce. She was broke. She didn't have any money. She couldn't do any lab testing. So we just tried to work with her and did everything here in the office. So, you know, I can figure out a lot of this in office. I mean, lab tests are really helpful for this, but I can figure some of that out. So I did low force chiropractic, took her off the foods that were causing her intolerances and desensitized her to the foods that were causing her problems. Gave her specific nutritional supplements to help her adrenal function. By the way, what do the adrenal glands do, and why would I work with that? Anybody?
Don't they help with the,
Good.
They help with hormones, for sure.
Yes.
So they're a backup system for hormones, especially for females going through menopause. Now, she was 13, so that wasn't the issue with her. But they also do your energy, your stress and energy glands. So they help your body deal with stress. They produce energy. They work with the thyroid. And so hers were pretty shot. You know, she'd been under a lot of stress. So the results, her migraines got a lot better. Stomach pain and vomiting were gone. Energy was back. She was able to go back to 7th grade and finish school. And she was able to go on an overseas mission trip the following summer. And because of this, she wants to be a functional medicine practitioner eventually. I think she still wants to be. I haven't seen her in a long time. So those are some of the patients that I've worked with. And I found that functional medicine works really well for a lot of things. Now, if you're pretty far along in the disease process, sometimes you can't fix it, you can just get it some better, okay? You know, it's like a degenerated spine. I can't grow a disc back, but we can keep the disc from getting worse, okay? So sometimes that's the issue. So, I know that probably some of you guys in here are thinking about people that you know that might need functional medicine, and I would say, have them call my office and we can talk to them and see if they'd make a good fit for our office. Okay. Does anybody have any questions about anything that I've gone over? Yes,
I
Terry.
do. With the adrenal glands, is there anything we can eat that will like kick them in gear and kind of help them out? So
Foods that are high in B vitamins and magnesium
okay,
are really helpful for the
Vegetables.
adrenals.
okay,
And you need to avoid things like sugar and processed food and donuts and pop and things like
So,
that. Yeah, which just
French
beats them
fries
to
are
death.
out.
Yeah.
But you're on to that, and yet if I walk in a drugstore, well, look at all the candy and pop and everything I'm gonna find on the shelves that will make you sick. Not
Yeah.
healthy.
Yeah. Oh yeah. You're right.
Mhm.
So you just don't go down those aisles.
Yeah, you don't go in.
Yeah.
You don't shop in those
Yeah,
aisles.
yeah.
But you're right. Yeah. We live in a society that creates illness in people.
Yeah.
And then big pharma comes in and they give drugs for the symptoms that don't ever really, in most cases, solve the problem that the person's going in there for.
Yeah.
And so, now I'm not saying you can never have an ice cream. I'm not,
Right.
I'm not saying that you can never
Or a
do
hot
that.
dog. Yeah.
But if you live off of that stuff,
No trouble.
that's a problem.
Yeah.
And that's gonna catch up with you
Yeah.
pretty bad eventually. Yes?
were you encouraged by that discussion between the two people that wrote the book?
Oh,
Think
yeah.
it's turning around, and how long is it gonna take?
Yeah, I thought it was fascinating, and I want to get the guy's book, Lies I Taught My Medical Students. I looked it up, and it's $35 for the, and I thought that's a little high right now. I'll read it. I read these books, and then they sit on my shelf, and so, I may try and get it, see if the library will get it, but yeah, I thought it was great, and I want to definitely want to read that book, because he was like, he's really this doctor was really into intermittent fasting. He only eats once a day. He eats a high ketogenic diet, high fat diet. I mean, he was really pretty specific about the things that he did, and he said it just gives him more energy, his mind is clear, a whole lot of things because of his diet. And he didn't do that before. I mean, he ate typical standard American diet, got sick. So the answer is, yeah, I was encouraged.
I think it's just criminal what that has done to our population.
Oh, yeah.
I mean, you're supposed to be able to believe your doctor.
That's what they were talking about. They were talking about that very thing, is how you can't, there's so many crazy things in medicine that just aren't true anymore. It's hard to believe what they tell you. You know, we saw, and in my opinion, we saw a lot of that during COVID, you know. Yes.
I've had a total hip operation, and every time I go to a dentist, they make me take 4 antibiotic pills. And how long should that just, I think they do it for legal safety, or kind of like that. But
Yeah.
there must be a connection between dentistry working on your teeth and some effect unless you take antibiotic pills. But every dental office does it. I forgot the name of the pill. And it's
Yeah,
but it's an antibiotic.
they give you antibiotics, right?
Right, yeah.
Right. That's true. And what do antibiotics do? They sterilize your gut.
Yeah.
They cause leaky gut and other things, which, you know, so yeah, I try and avoid antibiotics as much as I can. I'm not saying you should never take them. I'm not
Yeah.
saying that.
Okay.
Because there is a place for them. There's a place for painkillers, you know? I mean,
Okay.
you know, if you have a compound fracture, you're shot, or you're in a bad car accident, and take painkillers if you're in that much pain. There's a place for them.
Yeah.
But there's no place to abuse them.
Mm-hmm.
That's the issue. It's the abuse of pharmaceuticals that's bad, and the wanton misprescribing and overprescribing that we see in our society, which is really hurting people and causing bankruptcy and all kinds of financial issues. So that my philosophy is and will always be, I try and stay out of the medical system as best as I can. I don't want to get into it. I don't want to be a part of it. Okay. Maybe eventually, as I get older, I may have to engage it some, but I try and stay away from it because I've seen too much in 42 years of practice, just too much. And, you know, if you go to the hospital, let's say you have to go to the hospital for something. When you're released from the hospital, that doesn't mean you're healthy. It means you're healthy enough not to have to be in the hospital. You know, that's what that means.
Yeah.
Okay, so they don't create healthy people. And if you see what they feed people in the hospital, there's no way you can be healthy with that
Right.
kind of crap they feed you, you know? I mean, so yeah, you know, it's, in fact, I think one of those physicians was saying that, when he was, I don't know if it was him or not, one of his family members was in the hospital, and they brought up their own food to him because the hospital food was so unhealthy. So yeah. Anybody else? Yes, Kayla.
One was to try functional medicine and are taking like prescribed medication. The idea of going into functional medicine, be able to function without those, like, would you slowly take the person off those prescribed medications?
That's a possibility. I can't legally do that,
Okay.
but if the patient wants to do it, I can show them how to do it. I cannot take people off medication.
Okay.
But yeah, the goal is, if you can get off of it, to be able to do that and to stay off. But again, you know, if you've been taking a drug for 20 years, you know, basically you put your body on welfare in that area. So your body doesn't have to work. Just, you know, it depends on the drug. So it's going to take a long time if you can get off that drug at all. And maybe you can cut it way back, but you can't totally get off of it. And that I've seen that happen. And it's just kind of the way it is. So, but yeah, I try and I've seen so many pharmaceuticals cause the patient's problems that they come in with. You know, And so, you know, some of the people, and some people are aware of that, they just don't know how to get off of it.
Yeah.
So I will assist, I'll show them, okay, this is what you do, but I can't tell you to get off that drug. I can't, you know, that's not within my realm of practice. So, yeah. That's the best answer I can give you. Okay.
But if the patient wanted, that was their goal,
Yeah.
and.
Patient wants to get off of it. Yeah, let's try and help you do that. Let's try and get your body healthy enough to where you don't need it. That would be my thing, you know. And then you can do whatever you need to do, you know, to get off of that. So, but that has to be the patient's decision. I can't take somebody off of medication, even though I've really been tempted at times. I'll tell you that. Okay, anybody else? Good. All right. Thank you so much for being here tonight. The next one on April 9th is going to be the importance of the nervous system in health and disease. That's going to be a great talk on how the nervous system affects our function and why that is so important to keep that healthy. And then on the 23rd, April 23rd, I'm going to talk about a functional medicine look at cancer. Functional medicine approach to cancer. I don't treat cancer, but there are some functional medicine issues involved with it that are really interesting, and some nutritional issues that people need to be aware of. So we're going to do a talk on that. So thank you so much for being here tonight, and